السلام عليكم ورحمة الله وبركاته. اليوم لنا الشرف أنه نستضيف، وهو أهل البيت إن شاء الله مو استضافة، أستاذنا الغالي الكبير دكتور فراس رسول، أحد أبناء البصرة الأصلاء بالحقيقة، واحد من الأساتذة اللي قدم الكثير من عندنا كعراقيين بالحقيقة. وهو في موقعه في جامعة كوينزلاند بأستراليا. أنا واحد من الناس، وقبلي وبعدي كان هو سبب لوجودنا بجامعة كوينزلاند في فترات تدريبية. استضافنا واشترك بالإشراف علينا بالحقيقة، وتعلمنا من عنده الكثير من التقنيات والكثير من العلم الحديث. يعني أنا كنت معاهم بال 2007 2008. اشتغلنا على الطرق الحديثة جدا بالبلمرة في وقتها، اللي كانت بادية بعد 2002، مثل الاي تي ار بي، الرافت بوليمرايزيشن، رينج اوبننج بوليمرايزيشن، الثايوكليك كيمستري، وغيرها من هذه الامور اللي قدرنا نتعلمها بواسطته، وبنفس الوقت قدرنا ننقلها الى طلابنا في العراق وعلمناهم هذا الشيء. فالفضل كبير. في نفس الوقت اللي انا كنت موجود باستراليا، اجوا تقريبا بحدود 50 طالب ماجستير من كليات الزراعة بالعراق، احتضنهم جميعا. وانا من اقول احتضنهم جميعا، الاحتضان مو فقط بالسلام وتعال واعرفك، لا، في حتى بيته كان مفتوح لنا. وانا اتذكر بأول زيارة إلى بيته تعرفت على العائلة الكريمة، والوالدة الله يرحمها، اللي كانت يعني قمة بكل شيء، بالعطاء وبكل الأمور، بحيث أنا أول يوم طلعت بوست راسه، تحسهم أنه يحتضنون الكل. فاللي قدمه دكتور فراس بالحقيقة للعراق ولكل اللي احتاج كطلاب وغيرها ومساعدات في كثير من الأمور، كان هو يعني عند رهن الإشارة مثل ما يقولون، ما قصر إطلاقا. لذلك يعني له في القلب معزة خاصة. أتشرف بأنه اشتغلت تحت إشرافه. تواصلت من 2007 لحد الآن، ما انقطعنا الحمد لله والشكر. تكررت الزيارات، مرة إلى أستراليا بال 2012، بال 2014 وال 2011 نورنا في العراق، استضفنا بالبصرة بالمؤتمرات. فكل الشكر والتقدير للدكتور فراس لوجوده اليوم وتلبية الدعوة بنا. وأنا متأكد أنه المحاضرة راح تكون قمة بالجمال والعطاء. فدكتور، المايك حضرتك والشير لك إن شاء الله.
تسلم لي، شكرا شكرا دكتور أثير على هالمقدمة الجميلة. وطبعا لكم عزاز علي مثل ما يقولون، يعني الجماعة كلها بالبصرة، وأنا أفتخر بأن أكون ابن البصرة، وإن شاء الله المحاضرة تعجبكم ونقدر نسوي فتشي للبصرة والأهل البصرة إن شاء الله يا رب.
والنعم منا دكتور.
يا الله يخليك، الله يخليك. أوكي. كلكم تشوفون هالمحاضرة الحين، الاسم والش اسمه؟
ممتازة دكتور.
تمام تمام. شوفوا، يا مشكورين جميعا. ويتشرفني مثل ما تفضل الدكتور أثير بأن أن أبدي محاضرتي وياكم. طبعا التايتل مال المحاضرة هو العفو، بس في أوكي تمام. التايتل مال المحاضرة هو Rational Design of Nanostructured Polymers or Polymeric Material and Their Application. طبعا التركيز على الابليكيشن. أنا عندي طبعا شغف كبير للابليكيشن مال الماتيريال. طبعا الجزء الأكاديمي هو مهم، بس طبعا الابليكيشن هو كثير كثير مهم. وإن شاء الله أعطيكم نبذة على ابليكيشن بمجالات مختلفة من خلال استخدام النانو ستراكتشرد ماتيريال. طبعا أبدي أولا لازم أشكر طبعا دكتور محمد الرباعي على السماح لنا أن نستخدم اسم شبكة العلماء العراقيين في الخارج، وأنا طبعا جزء من عدها، وشرفني أن أكون جزء من عدها. وإن شاء الله المحاضرة تعجبكم. خلي أبدي أولا بالنانو ستراكشرد بوليمريك ماتيريال. بالمناسبة راح أتكلم شوية مخلوط عربي وإنجليزي، عارفين أنتم شوية المشاكل مرات واحد ما تسعفه اللغة العربية بصورة جيدة. ف النانو structured polymeric material and I could consider it as a platform technology, and which can be really engineered to target a specific application, especially in area of an important in our life. And it is a multidisciplinary research. It can really cover a variety of application. As I said, it is in diagnostic, in treatment, in drug delivery, herbicide delivery, in the nutrition. We could go other area in the filtration and nanofiltration. طبعا المهم عندنا oil water separation and gas drying, which I'm going to give you some examples on that, and also gas separation, heavy metal removal, also nanofiltration in the microorganism and biomolecules. Also, it's very important in the area of surface coating as anti-corrosion material, antimicrobial or antibacterial. We also used it a few years ago to develop a special coating for the solar photovoltaic cells to prevent accumulation of dust and it's easy cleaning. So as you know, in our area, especially with the use of solar panels for photovoltaic, for generating electricity, you find there is a lot of dust accumulation on top of the panel, which reduce its efficiency. So we did develop some material which can be really used to reduce the accumulation of this dusty material on top of the solar photovoltaic cells. Again, it can be used in the oil industry, in the enhanced oil recovery, as a drilling mud, as a surfactant, as emulsifiers. Hopefully today I will give you some example, or at least one example, which is mainly in the sensor for detection of H2S gases in the oil industry, detection of pollutants. Now we're having a big project working on CO2 capture. This is a collaboration with Professor Yagi from Berkeley, Omar Yagi from Berkeley. And this project is actually designing some COF material, which is covalent organic framework materials with functionalized group, amino group inside it. We will be able to monitor or modulate the porosity and the size of the pores and the number of linkage which can really capture the CO2. So this is, I'm not going to talk about this project today, but at least I could really mention it to you at this stage and give you a hint what we are doing currently in Kuwait. As I said, it's a multidisciplinary research. Definitely, and always I try to encourage people, nothing secret in research. You should really collaborate. Collaboration is the best thing to do. You cannot work, especially with a young chemist, young scientist, they cannot work by themselves in vacuum. You really need to work with other people, collaborate very, very closely. It depends on the area you are working on, and also depends on the application you are targeting. You could collaborate with an engineers, you could collaborate with a practitioner, whether it's in the medical side or in the dentistry side or wherever. So it is important for any successful project to collaborate in order to design a product. So you could design a product according to the requirement. Look, for example, I mean, a lot of chemists, which I know, they go and do the best product. They could publish it, a best material. However, when it comes to application, you don't find any application, either because it is very costly to make, either it is probably not easy to adapt for that application. So instead of you design your chemistry and you go and find an application, actually the reverse. You should understand what is the application requirement, talk to people about it, and then design the chemistry which suits that particular application. Today, hopefully, I will give you, as I mentioned earlier, some case studies, give you examples of successful technology we developed. We also try to, try to highlight the importance of collaboration in a very, very true multidisciplinary research. Let me start first with probably a company which it was a spin-off company which I initiated with a couple of colleagues in Australia. It is a biotech company. We were focusing mainly on nanostructured surfaces excuse me, Dr. Athir, there is a lot of comments comes on the top of my screen, so I will not be able to read my slides.
احاول انا اخلصها بسرعه ان شاء الله دكتور اللي تظهر.
اوكي
فقط الدخول اللي يعني اللي يدخل فقط تجي
تسوي له admission. Okay, that's
تمام.
Okay, thank you very much. Yeah, so it is a it's a nanostructured surfaces for biotechnology. I mean, we were looking for nanosensors mainly for developing protein-friendly surfaces, and it is a microarray type of things. You see the three founders. You find them; they are from different discipline. We have Dr. Joe Meiji. He is a peptide biologist. Myself, and also Dr. Jeff Wickham. He is a medicinal chemist. The main objective of that, of course, of this company, it is to develop a process for high throughput synthesis, what we call it combinatorial synthesis in a drug discovery, which I'm not going to talk about this today. Hopefully it has been, I can cover it some other time, but mainly I'm going to focus today on the development of novel materials for diagnostics in high density array. And of course, I mean, the company was young. It started in about 2000, and then it was acquired by another company after we developed that technology, which I'm going to show you some of this technology. Basically, it's very, very simple. We take a plastic like polypropylene or fluorinated polymer, Teflon or any other type of plastics, and then we graft on top of it another type of polymer like polystyrene or polyacrylic acid or what have you. And then, of course, we functionalize it with a linker. And this linker, you could conduct your chemistry or you could do whatever on top of that linker. So instead of you doing your reaction in a beaker or in a round bottom of flask, you do your reaction on the surface of a material, on a plastic material. And this plastic material, which I probably go back to the slides, look like that. It's a high surface area solid support. And even all this work has been automated by inserting a radio frequency transponder, so you'll be able to follow the reaction from beginning to the ends. Okay, the most important or critical component of that, it is to really try to optimize your processing of the plastics. Injection molding, which is typical machine used for making polymers, plastic material, like, for example, polyethylene or polypropylene for general uses. In our case here, we used it to make these tiny little, it's about 5 millimeter to 6 millimeter in length, bits of a plastic. It is based on polypropylene. However, the important thing, it is to make sure the surface of this is uniform. It has minimum stresses. You don't want to have any stresses, because stresses, when you do the grafting, actually there is an accumulation of a polymer grafted to the surface when there is a cracks or there is a stresses. So try to really make the surface pretty uniform. Of course, we have to understand the polymer flow behavior in order to design the condition in the injection molding to produce a perfect material with uniform surface. Also try to control the melt injection pressure and the temperature, controlling the gate position, where the gate of the injection happening. You don't want it in an area where it's going to be a lot of stresses. It will be a lot of polymer grafting on that. So trying really to put it in a position which is almost hidden. So you will not be able to affect the performance or your grafts. Of course, the cooling, it is important in any processing. You don't want to cool your polymer so suddenly quickly. You need it to cool gradually. and in order to balance between the crystalline phase and the amorphous phase. You know, a crystalline phase usually does not graft very, very well. If you want to put a polymer and graft it on that, it is very, very hard to graft on a crystalline phase. So it is the grafting is happening usually on an amorphous phase of the polymer, of the plastics. And the plastic we are using, as I mentioned, it is fluorinated polymers like PTFE and others, and also polypropylene. We found like polypropylene is probably much easier to handle. It is easier to process, while Teflon sometimes is very, very tricky. It requires a higher temperature. It is also grafting onto Teflon. It is extremely challenging. What we used, actually, we use a variety of different techniques in grafting polymers. For example, for styrene and polyacrylic acid, mainly we used gamma radiation. And this is a picture of the gamma radiation. And of course, you have your plastic, which is these or these, and then you put a layer, uniform layer of another polymer. If we have polypropylene, on the top of it, we put a sorry, I use the laser, which is better. We put a layer of polystyrene, for example, or polyacrylic acid, and then we will be able to functionalize it. We make it amino methyl polystyrene, and this is where we have an amino group, and this amino group, it can be really used for further functionalization. As I said here, the application is surface, surfaces is for diagnostics. And optimum biological responses. And also we worked on solid support surfaces in the drug discovery. Again, I'm trying really to focus today on the first item. What did we do? Here, for example, I'm giving you an example of a polypropylene surface, and we grafted a polyacrylic acid layer on top of it, but actually we use vinyl ether as well. So it's a copolymer, both of them. And then we reacted that with coupled with gifamine in order to introduce that amino group onto the polyacrylic acid. And of course, then afterward, we put an ATRP initiator. This is the ATRP initiator here, where we will be able to start polymerization, radical controlled free radical polymerization onto that surface. So you have the acrylic acid attached to gifamine with the amine, and then we added this initiator, and from that initiator we will be able to build up a different architecture. So we prepared the block copolymers, we prepared the branch copolymers, and variety of surfaces. And of course, all these polymers, you choose them to be useful for a variety of application. And this architecture, we found some unique characteristics with this architecture, which I will probably give you some results on that. Okay, so let's go for now is a little bit more sophistication. Which is special surfaces for protein capture and diagnosis. Of course, as you know, polymers, when for example, protein come and adhere to a surface, it is denatured. So what we are trying really to prevent the denaturing of the protein by preparing the right polymeric surfaces for that application. So the work we worked in Polymerat, the name of the company Polymerat, we worked in developing surfaces for diagnostic. Particularly, we were focusing on prostate cancer and also for breast cancer, which is actually the main focus. It was on the prostate cancer. We started initially looking into, beside that, surface grafting, etc. But then we start looking into developing some sort of a star type of branch polymer. We use such material, such compound, and then we attached ATRP initiator to it, and then we start different polymerization from that, and you build up a star with a controlled molecular weight. Here we use a polystyrene, and we built it in. And what we found, very, very interestingly, when you bring this one, these stars, or even with the COM, with the blocks, polymers, and others, when you dissolve them and you put them on any plastic surface or any surface, even a glass, and you let them to evaporate slowly in order to prepare a surface, you find them, they are forming this fantastic, very nice honeycomb structure. And we found an old paper talking about that, actually. When you dissolve a polymer and you put it on a glass, this is a polymer solution, and you try to use an airflow, very, very slow airflow on top of it, start to evaporate the solvents. By evaporating the solvent, it seems like you are condensing a droplet of water because of the humidity from the environment. And this droplet of water, it is getting bigger and bigger. And as you progress in the evaporation, the droplet has become like almost hexagonal in shape. And this is really one of the characteristics which we found it very, very interesting in order to increase the surface area of these the plates, you know, the biological or the macro plates. So I think it would be really a good idea to use this technology, which we used it later on. How did we use it? We prepared a grafted surface of polystyrene, as I showed you before, and then, of course, polystyrene, and then functionalize it with glacidyl methacrylate, as you see that. So sorry, it's a copolymer between polystyrene and glacidyl methacrylate. It's copolymerized. It's a block copolymer. Then it was casted on a surface. We evaporate and we form that honeycomb structure. Of course, we introduced some radiation active molecule into that, which I'm not going to talk about it now. And then when you zap it with gamma radiation, it's a freeze that structure onto the surface. And this is where we will be able to freeze it. It will be a permanent surface, high surface area, even though it's on a micro plate, which is a tiny little, it's probably about 2 to 3 centimeters in length. So this is really what we did. We have this glacidyl functional group, which is active. We use this to functionalize it with biotin. Probably Dr. Mohammed Al-Rabai, he is very familiar with this type of things, this type of chemistry. It is reacting with this to form a surface functionalized with biotin. You will be able to use a variety of different amino group or in order for use it for a variety of application. And of course, as a chemist, we always try to do the characterization, and you could see clearly this has been already grafted, this biotin into the microtator plates or this plate. Okay, so because of this technology, Polymerat was taken over by another company called Entio. We had some protection, patent protection on that, but mainly all this technology, it was a know-how. Even when we transfer the know-how to the new company, I had to sign a statement saying like, I will not talk about this for 5 years. And now, since it is more than 5 years, I'm quite free to talk about it. And then Entio, they start using it for developing a different diagnostic kits. Even now, which I saw on their website, they are working on coronavirus kit, which is based on a quite similar technology like what we developed many, many years ago. Okay, now the question, how this platform technology, which I told you about, the grafting, et cetera, can be adapted and applied to other useful application that may have a major impact on our life. I think it is, we try to branch from that platform technology to use it for a variety of other technologies, more sophisticated, probably more seen by a lot of people. It's even, it can be really applied on daily basis. One of them, it is using this, I call it soft nanostructured material. The other alternative, which is the hard nano materials, which is the nanoparticles. The nanoparticles, which is metal nanoparticle like iron oxide and the silicate and others. So all of them, they are hard nanoparticles. The hard nanoparticle sometimes is very, very hard to handle. because they have a hard surface, very inert surface. You really need to use a specific or a special chemistry in order to modify that surface. However, with this technology we developed, we will be able to develop a soft nanostructured material. And it can be used in a variety of applications. One of them is membrane technology. Membrane technology can be used in the water desalination by putting the right material. It can be anti-fouling, probably putting some material which is a prevent fouling onto this membrane. I mean, especially in the Gulf region, they use a lot of these membrane as RO, reverse osmosis membrane, and forward osmosis membrane, and many other applications. So what happened, it is from the seawater and from all the biological compound and macromolecules, they start to foul, causing blockage of this porous structure on the membrane, and try to reduce its, not trying, but it is reducing the efficiency of these membranes. Okay, so if you look at it, I mean, even though we did not do much active work on that, but we are planning to do this. But I think this is an area very, very important to look at it, particularly people from Iraq, from the Middle East, because now almost everybody using reverse osmosis membrane for this particular application. How can we improve it? How can we use it for salty water, brackish water, and any other type of water? So this is one of the areas. However, today I would like also to mention something which is probably nice to look at. It is looking into a grafted surface, this type of grafted surface, and then we attach an ATRP initiator onto that surface. Sorry, Dr. Athir, I don't want to go into detail of the chemistry because I thought the audience is quite diverse. So I thought I'll just mention the application and try to highlight this. But if anybody interested, then they will be able definitely to get in touch with me, with Dr. Athir, and we will be able to give you some more information on how to do these things. So you will be able to build up a polymer onto a surface like such. And this is, we use here polynipam. This polynipam, it is well known to have a very, very nice lower critical solution temperature. So this is LCST. And the LCST, it is, if you take the polymer, because of the hydrophobic interaction, if you take this polymer and then if you cool it down, you find it has become soluble in water because it's forming a hydrogen bond with the water. But when you heat it up, it is actually precipitating. So we try to capitalize on these characteristics, the LCST characteristics of polynipam, in order to use it for a unique application. And this application, it is to dry stream of gases, especially natural gases and others. Could be really used for a variety of applications. If you have natural gas or even nitrogen or any other type of gases which is full with moisture, then you will be able to use this technology in order to dry it. You're using, for example, a nanoporous type of membrane. And this one, of course, when the temperature it is low, you find this is very, very solubilizing, and the polymer chain, they are floating. Then when you pass any liquid, for example, water, moisture, then it will capture it and swelling it. Okay, it's become swollen. And then, of course, when you finish from drying, you take that membrane and you heat it up. Not very high temperature, is about 37 to 38 degrees centigrade. You find it will shrink and get rid of all the water which has been absorbed by the membrane. So this is one of the application, which is very, very interesting, I believe. Oh, okay. Other application we looked into it is antimicrobial membranes. Again, you will be able to have similar chemistry, ATRP. It could be glass, which I'll show you how to do that later on. It could be metal. It could be any type of surface. and then you grow polymers on top of it. You will be able to grow, for example, polymers like polydiamine with quaternary ammonium salts, and this is useful for, I think it is useful for gram-negative. Correct me if I'm wrong. And the other one, which is another type of polymer, and this one, which is TMAM, and this is, again, it is useful. It has a fluorinated group attached to it, and this fluorinated group, it is good to kill bacteria, which is gram negative bacteria. So you will be able to have a surface which has a dual function, which can be effective in the gram positive and gram negative type of bacteria. Other application, as I mentioned earlier, it could be for this grafted surface, it could be for diagnostic, which I mentioned to you. I mean, it could be really making these polymer chains. They could be polymers like polyethylene glycols. They could be polylactic acids, which is degradable. They could be any type of polymers. You will be able to make a fantastic, nice brush-like or a comb-like type of surfaces. And you will be able to functionalize it with a variety of things. For example, here, antibody for biomolecule capture. This is for diagnostic application. You could see, you put a receptor, and then, of course, the protein or any other biomolecule can really click itself into that type of surface for diagnostic application. Or it could be, for example, putting some sort of a molecule like that, which is a ligand with high affinity to metals. And this can be really used for purifying, water from heavy metals like mercury, cadmium, palladium, and others. So, or lead, sorry. This is one of the, also another application which can be used for such type of surfaces. So as you see, the chemistry and the process and the technology, this platform technology, it can be adapted to a variety of different applications. It depends what is your interest, what is your client interest, how they're going to do it. Excuse me. Okay. Now I'll try to really, again, highlighting this. I mean, I already said it. The grafting technology is a platform technology, and the surface modification, it is unique. It can be, as I said, adapted to a variety of. So the chemistry is very, very similar. As you see earlier, you have surface of a plastic or a glass or what have you. You graft a layer of on top of it, another polymer, functionalize it, or some of the polymer they already functionalized, and then you will be able to build up on that. You could build up a variety of different type of nano-structured, controlled polymerization with a specific length, the chain length. And of course, the chemistry is very similar as here. However, the novelty is to understand the design criteria. Design criteria is very, very important. You need to communicate with the practitioner, with the engineers. You see what they want. Therefore, then afterward, you will be able to design your material based on that design criteria. And then, of course, the adoption of this technology for a variety of applications. I'll move a little bit now to something different, slightly different, which is a novel nanosensors. Again, this is a nanostructured material mainly designed to capture H2S for application in the oil field, as an alternative to the traditional approach. Traditional approach, usually they have a probe and they put it in the well, oil field, and then they take a sample, and then they do the characterization and find out what is the level of H2S. And this is this type of oil, they call it sour oil, which is very, very corrosive. It is very toxic. As you know, H2S is very toxic. So really need to have a very, very simple technology, which can really be quantified, injected in, and then collected from the other side, and you will be able to quantify what type of, or what is the level of H2S in that field or wherever, or even in a reactor or in the refinery, etc. So this is really what it is. So what is the requirement for this? it has to be the applicability of these nanosensors in the oil field. It has to be easy technology, comparable with whatever is existing technology. The synthesis of these nanosensors, it is easy and scalable. You will be able to produce it in larger scale. It's cheap, of course. It has to be cost effective. And of course, the nanoparticles and the chemicals, both of them should be cheaper, relatively cheap, in order to use it for that application. And of course, the response to H2S, it has to be fast and easy detection and characterization, for example, by spectroscopy or by any other means. So this is where you will be able to think what you wanted to do, what type of technology, what type of sensor you wanted to use. So this is an example of that, which I'm just putting it here for you. You will be able to inject your nanoparticles, functionalized nanoparticle, and the injection well, and you collected it from the other side and react, and then you will be able to analyze how much H2S has been probably in that. What is the level of H2S? So you will be able to quantify it by using fluorescence spectroscopy in our case, and this is what I'm going to show you how we synthesize these materials. This is actually the polymeric nano structured particles. Mainly, we started with polyvinyl acetate, polyvinyl benzene type of monomers, and we copolymerize them. This is just to produce a nano structure using emulsion and suspension polymerization technology. And then we functionalize it with this. And then, of course, this one, it has nitrogen oxide. Nitrogen oxide, it can be reduced with H2S in order to convert it to this. This is non-fluorescent, while this one is a fluorescent. So if you inject this material, you will be able to convert it to that. Reaction is relatively fast. Within probably a few minutes, you will be able to collect it from the other end, and you will be able to quantify it through looking into fluorescence spectroscopy. So you'll be able to use this technology to interrogate the functionalized nanoparticle with lights and measure the emitted fluorescence in order to assess the concentration of H2S. So this is really the approach. So let me start. For the chemist, I think probably the majority of the participant might be chemist. To show you what did we do. We started with this type of molecule. It is commercially available starting material. Then, of course, we reacted with 6 amino hexanoic acids, a molecule, again, a reaction through the amine group here. Then we will be able to produce that compound. And this compound, of course, it has nitrous oxide. It is not emitting. It is not a fluorescent. And this is really what I'm going to designate that symbol for all these type of material. It's a dye, non-fluorescent dye. Okay. And then, of course, this is some of the analysis, infrared, nuclear magnetic resonance we did, and also UV spectroscopy. So this is a full characterization of any material we make. And this is a routine things for any chemist. We could really do that. Okay, so we had this one. And then this one, we treated it before we start couple it to a nanoparticle, particularly the one which we were talking about, the polyvinyl acetate, polyvinyl divinyl benzene particles, the emulsion polymerization, the suspension polymerization particles. Before we couple it to it, we really need to evaluate this. So what we did actually at a pH 7.4, 37 degrees centigrade, even though the reaction in the oil field, it is, the temperature in the oil field is quite high. And we reacted with H2S, and you find easy to convert the NO2 to NH2. And of course, the material from non-fluorescent become fluorescent. And you could see here the absorption at different levels. And then here it is the fluorescence in here, which is a broad peak of the fluorescence. Exposure for 60 minutes and exposure for 5 minutes. But if you leave it longer, of course, you improve on that. But again, you need to optimize what you really need looking for. So, but I mean, I guess this level of emission, it is relatively good, comparable with the absorption. I mean, here it's probably we need to normalize it. And if I remove that from the spectrum, then you will be able to see a very broad peak, the fluorescence from this type of molecule. Okay, going back to how to make these suspension polymerization nanoparticle, which, as I said, it is from vinyl acetate with divinyl benzene. You copolymerize it using emulsion and suspension polymerization technique. You produce this hydrophobic particle suspended in water. Then you hydrolyze it. You hydrolyze the acetate to convert it to an OH, which is acrylic acid, basically. And you will be able to use that acrylic acid. Again, we characterize it before hydrolysis and after hydrolysis to make sure the hydrolysis is happening. And of course, here is showing you the suspension and the average particle size. We measured it using size characterized by dynamic light scattering. You could see the size of the particles between 61 and 48 nanometer. So they are in nanometer scale. And this is really useful because if you try to inject this in a well, for example, formation in rocks, it will be easy to pass it through and move to the other side. And even if you use it for other application, so it could be really easily too. The only problem we were facing with this material, because it's an organic nanoparticle, we are not sure, even though it's a cross-linked, we are not sure whether it is sustaining the temperature, higher temperature application. So we looked into that, and alternatively, we looked into solid nanoparticle, which like silica and ferric oxide and others. Okay. Yeah, so this is the characterization for that. Again, what did we do with that after we hydrolyze it? We sulfonated it, putting that sulfonated group. It is pretty straightforward chemistry. It is a little bit slow at room temperature, 72 hours. And then we converted that sulfonate to azide, reacting it with sodium azide at 80 degrees centigrade for 48 hours. So we have a reactive group, which is azide reactive group. Then using propagyl amine in order to do this is a nice click chemistry. Dr. Athir, probably he used it quite often. We used it since some time ago for a variety of application, and it is very, very efficient reaction. It's been invented probably and started by somebody called Craig Hawker. He is from Berkeley in Santa Barbara. He is an Australian scientist, and he moved to US and he worked in US, and now he is the chairman of the material section in Berkeley, in University of California at Santa Barbara, not in Berkeley, sorry, in Santa Barbara. So this is the click chemistry which is happening. Then we will end up having something with an amino group attached to it, and then we use that amino group in order to introduce our fluorescent dye molecules into this connection. So by simple reaction, the amine esterification reaction, amine reaction with an acid in order to couple it. So we coupled all these into the nanoparticles. And as I said, this is the symbol of it. It's been coupled, and we looked into the absorption of these UV spectra, which is confirming the coupling. And also we looked into the fluorescence by exposing it to H2S. This is non-fluorescent, become a fluorescent. Because of the broad peak and because of the high concentration of these functional group and the level of a fluorescent dye inside and outside of the nanoparticle, because this nanoparticle is porous, we found it is very, very difficult to directly measure the signal coming from the fluorescence, because there is a lot of interaction and there is a lot of excimer fluorescence coming up. So we found probably a ratiometric signal, potential easier to quantify, comparable to looking into the excimer fluorescence, which is very, very difficult and very complicated to analyze. So we found this, even though, I mean, there is some background fluorescence coming up before exposure, but then after exposure to H2S, you find the peak is really extremely high. So there is a good fluorescence coming from that. This type of work, definitely this project and this approach requires some fine tuning. And I think we're still having some difficulties in fine tuning all this work. So hopefully we will be able to do it in very, very near future. Okay, so now what I gave you information about this and the polyvinyl acetate or polyvinyl alcohol, after we converted it with divinyl benzene cross-linked, and we coupled this to it and we evaluated it. As I said, the difficulties from that make us probably thinking, because of the temperature, especially if you want to use it at a higher temperature level underground or somewhere else, then this might be not stable enough. So we thought, okay, why we don't use a silica nanoparticle? Quite similar, the chemistry is quite similar, but I will just show you now how we do it. We take the silica nanoparticle, we reacted with that. If you see, I don't know whether it is visible for you, it is coupled like that in here. And of course, after we coupling it, we did some free radical control polymerization. We introduced, before that, we introduced an initiator. This is the initiator. By the way, this coupling is happening with a ATRP initiator attached to it, so it's attached to it. Then we start polymerization using PEGMA, polyethylene glycol methacrylate, in order to start polymer chain from that. We're still having this bromo functional group, which is useful, as you see it here. And of course, this material is commercially, the silica is commercially available. We just got it. The size of it is about 130 nanometer. We reacted with this compound, and then we did a controlled ATRP initiator. We did controlled polymerization using polyethylene glycol methacrylate via ATRP initiation, and then the chain density, we measured it. We see the PDI, it is pretty narrow. Again, you see the molecular weight, it is about 125,000 to about 100,000. And this is also what we saw. It seemed to us the chain attached to the surface is pretty dense. So when they are concentrated, you find them, they are aligning with each other. They make it much easier for you to access that bromine group here in order to use it for further functionalization. While it's a lower functionalization or lower polymerization using lower concentration of that in the first step, you will end up with a semi-diluted or diluted. If they are diluted, you find all the chains, they fold onto the surface, and they are not very easily accessible to do further polymerization and further reaction. So this is one of the disadvantages, but however, we found this one by higher concentration, it is good. But again, higher concentration, it has disadvantage because of the excimer formation. So this is another issue which we think of. Of course, we did some characterization, transmission electron microscopy. You see the size of it and the size distribution of these nanoparticles we made. We did also AFM analysis of that. And again, after we did that, sorry, before going, after we did that, we went into do functionalization, putting that dye into it, the pigment which we synthesized earlier, using this bromo compound, using similar chemistry, convert the bromo to azide, the azide with poryl amine, we convert it to amine group by click chemistry. Then we couple the dye, same chemistry as the previous one. And then, of course, we did some evaluation. You find here, we used excitation wavelength 340, and you could see the fluorescence result is quite substantial. And this is really what we use for that particular application. So by changing the particles from, sorry, before going here, changing it from soft, what I call it soft nanoparticle, which is based on the cross-linked polymers. We convert it to silicate type of particles, nanoparticles, to improve the performance under high temperature, improve of this under high temperature. So this is one of the application which I mentioned. Simultaneously, we worked with another collaborator from one of the universities here in Kuwait, which is Gulf University, Gulf Technology, University of, Gulf University of Science and Technology. And they were having a slightly different proposal. And their proposal, it is to use this fluorescein and then reacted with that, forming this compound. And this compound, of course, tried to link it in the same chemistry to different type of nanoparticles. So they use iron oxide, they use aluminum oxide, they use copper oxide, they use titanium silicate, they use a variety of them. And of course, again, it has, if you look at that group, R1, which is a dinitro phenyl group. And this is where, when you expose it to H2S, it will convert to an amine and it's become a fluorescent. So the fluorescence, we could quench the fluorescence of that by doing this reaction, but then when you reacted with H2S, it will reinstate the fluorescence. And really, this is what happened to it. This is just giving you an example of that. By the way, this has been published recently, and this is a publication here. You could see it in 2021. Okay, so this is another approach for that. Okay, I'll move a little bit now different to biomedical application. I gave you some application variety and started with the diagnostics, moved to membranes, then I moved to this nanoparticle, solid, hard nanoparticle and soft nanoparticles for a variety of application, which is mainly in the sensor for detection of toxic gases and others. I gave you an example of H2S. Now I will move to probably more into the nanostructured polymers for biomedical application. Okay, and it could be for biomedical application, could be an organic-based nanostructured material like this one. This is, by the way, commercially available. That's why we are lucky to have this type of structure. It's hydrophobic, and I'll show you what we used it for. And then, of course, we have the hybrid type of nanostructured material. Again, this is called POS. Again, this is a silicon oxide-based nanoparticle. It's a halo structured nanoparticle. It's about 8 nanometer in diameter, so it's a pretty small. And it has some organic functional groups, so you'll be able to utilize that in order to make something useful from this. And again, I'm going to give you some examples of some of the application of this and that. And of course, we have inorganic-based surfaces or nanoparticles, which I already talked about it. This is the one. Let me start with the hybrid initially, and then I'll move to the other one. The application, we use the hybrid nanoparticles here for two applications, as a bone cement, as well as a glass ionomer cement. This is used for dental application, for filling, dental fillings. Most of elderly people, they usually, with any accident, they crack their vertebra. الفقرات مالتهم تنكسر أو فقرة واحدة تنكسر. And this is very, very painful. So the typical curing, they try to inject monomeric cement. And typically what they inject methyl methacrylate. Methyl methacrylate, it has very, very low viscosity. It's like a water. And plus, it is very, very toxic. But I mean, whether you having the pain or you accept to have some small toxic material, which might be probably causing some issue, but it will disappear after the polymer cures. Plus, when the polymer cures, it produces very, very high temperature, is above 55 degrees centigrade. And this is an exotherm temperature. And this exotherm temperature, it might cause necrosis. It might kill some of the tissues surrounding the vertebra. So there is a major disadvantage of using it. But as they said, it is this is الشر أحسن من واحد ما ياخذ هذه وتبقى الفقرات مالته مكسرة. It is very, very difficult. Anyway, this is a compromise solution. So we worked with people from the hospital on a project which we looked into that, the POS, which I mentioned it to you here. This is the long name of it. It's a hollow particle, 8 nanometer. And this hollow particle is produced and is commercially available. You will be able to search it and find out the supplier of that. I should have put the supplier name here for people who wanted it, but you could contact me if you want to. And this mainly used for reinforcing the glass panels in the fighter jets. They usually put a polyurethane sandwich between two glass to prevent or to improve, to make the glasses bulletproof. So they use this compound with polyurethane as a reinforcer in order to prevent the shattering of the windscreen in jet fighters in any airplanes. So this is really one of its applications. As I said, we looked at it. It is very, very nice molecule. It has 8 reactive sites, and it comes with different organic compounds. You will be able to functionalize it differently. It's a provide site for functionalization, as I said. It is a hydrophobic cage, is ideal for improved mechanical properties, as you see it here. It has been used for this application, as you see it here, for that particular application. And also what we found, it has very low toxicity and leachability if you put it part of the polymer. But in our case, because we're not going to use it as itself, it's going to be attached to other polymers. So the leachability, definitely it will be diminished. What we did, we bought this type of functional group. It has an acetylene type, sorry, it has a double bond, carbon-carbon double bond, which is octavinyl POS. And we reacted with a fantastic, very, very fast, very efficient reaction. It's happened with this thiolene, okay? The thiolene chemistry under UV light, it just goes like that. Probably like less than 1 minute, the reaction clean and completed. So you will introduce this acid group into the POS molecule. And then, of course, what we did, we tried to extend it by putting polyethylene glycols. You will be able to use a different type of polyethylene glycol. In our case, we use the 9 repeated unit of ethylene groups. Sorry, polyethylene, the ethylene oxide groups, 9 repeated units, which is the molecular weight is about 400, but you will be able to go for much higher as you wish. So we hooked this one through a simple chemistry into that POS. And then, of course, we use acrylyl chloride as a monomer, where we will be able to functionalize that OH and convert it to a polymerizable group. So this is the symbols for that, each one of that. So it is actually, we made a nano, a porous particle, which has a polymerizable functional group. And it can be used for a variety of applications, one of them which I would like to mention now. But before going to that, of course, for our friends, chemists, the audience, since I'm a chemist, I'm always passionate about showing these. I mean, this is the NMR spectra for the POS before reaction, after introducing the thiolene, after putting the polyethylene glycol, and after making the polymerizable group, which is the acrylate group attached to it. And all of them, they look very nice, very, very clean with all the integration of these peaks. So there is no issue. And I think this is already published sometimes ago. And again, showing here the FTIR spectra of the POS. You've seen it for the initial, for the second one, which is with the thiolene chemistry, with the polyethylene glycol, and the final one, the polymerizable. Fine. So how we used it. for that. We used it in combination with two monomers. These two monomers, they are typically used for a variety of applications, and one of them is for dental fillings. But we combined it with our nicely developed one, this POS. And we expected by combining this, first of all, because they are macromolecules, when they polymerize, they don't produce high temperature. So the temperature is going to be, the exotherm temperature is going to be much, much lower than using a different type of small molecule monomers like methyl methacrylate and others. So this is one of the expectations. Of course, when we combined all these three together and we polymerized it, then we looked into the commercial, which is these, and you could see the commercial cement, and then compared it with only using 2% of this POS. You could see there is almost 40% improvement in compressive strength. Not only compressive strength is important in the vertebra repair, but also the important it is during the polymerization. This material, it is low leachability, is non-toxic. They will be able probably to polymerize with very, very high increase in the exotherm temperature comparable to methyl methacrylate. So all these advantages of using this type of monomers in combination in order to repair vertebra like that. So this is another biomedical application. As I mentioned, using this similar POS molecule, but here we're going to use it in the repair of tooth, which is there is a material called glass ionomer cement, which used in the fillings, particularly for children. But this material is not suitable for filling back teeth, molars and others, because they don't have very, very strong mechanical properties. And usually this type of glass ionomer cement is produced, the main producer is a company called GC in Japan. They are the supplier of this material, a major supplier worldwide. And this material is basically, it's a copolymer of acrylic acid with ataconic acid. So these two type of monomers, they copolymerize randomly and mixed with fine glass particles. It's called calcium fluoroaluminium silicates. And when they mix with it, actually they form some sort of a salt bridge because of these acid groups. So they form a salt bridge with the calcium, they form a salt bridge with the aluminium, etc., etc. So they are curing by this technique. That's why this salt bridge, it is very, very susceptible to acids. If somebody drinks a lot of Pepsi Cola and Coca-Cola and having this filling in his teeth, then probably you tend to break this bond and make it weaker and weaker. And of course, the advantage of this type of glass particle in this application, it is to use it, you have a fluoride. So when you use this type of filling, especially in children, they start the material start after curing producing or introducing fluorides continuously from leaching from that matrix because of this glass particle. So it has a useful application. Beside it is filling for a temporary, then it is also producing fluoride, which is essential for the teeth. So this is really one of this material. So what we did actually, if you see here, we did some ATRP chemistry, same like before, and we attached polyacrylic acid. And we have a polyacrylic acid coming from this molecule. Acrylic acid is coming, or acid group, let's say, acid group coming, carboxylic acid group here, carboxylic acid from ataconic acid, and carboxylic acid group from this molecule which we produced. So when we combined all these three, before we show you some mechanical property, again, this is the NMR spectra before thionyl chemistry, which I showed you before, and then we introduced the ATRP initiator. The ATRP initiator, this is where we start the polymerization of acrylic acid from that. So it's all the chemistry is clean and nice. This is the atom transfer radical polymerization of acrylic acid, and we start producing a chain of acrylic acid with limited chain length. We characterized it fully as a polymer with other techniques. And we looked at the transmission electron microscopy, and you could see these halos is not as clean as the previous one, which I showed you for the other metal nanoparticles. But this one, you could see the average size of that is about 33 nanometers. As you know, this is 8 nanometer, and it seems all these chains around it, surrounding it, like the shadow here, you could see it, shadow here. And this shadow, it is actually this extended polymer chains around this type of hybrid nanoparticle. Looking into some results, which we did, we saw very, very nice results, particularly when we use a small amount of this material in the combination with the other acrylic acid and itaconic acid. You see almost 48% improvement in increase in fracture toughness. So this type of material can be used for application in the molar, which is the back teeth, rather than only the front teeth. And of course, this work has been funded by the company, the Japanese company, the GC company. Okay, so now talked about this earlier. We talked about the hybrid. Finally, how I'm doing with time, yeah, Dr. Athir? Am I okay?
time كله إلك دكتور.
Oh, okay. Thank you very much. It won't take me very long. Almost we are تقريبا
لا تباوع
ساعة.
للساعة، لا تباوع للساعة.
Thank you very much. شكرا جزيلا. Thank you for the time. Anyway, now I'm going to really talk about the organic-based nanostructured material, which is this one. This is called Bolton. Again, it is commercially available. And it's a funny story how we put our hands on it. I think because we looked into the literature, we found it has been used for a variety of applications. And one of the main applications is to improve the cross-link density of dental fillings, dental material, the normal dental material. The dental material which can be used by using light in order to cure it is the white filling, is not the amalgam filling. Of course, this is now one of the main material used. Not this one, but I mean the filling is the main material used, and there is a variety of them because there is a lot of company making these dental fillings. So what we use this actually, before I go for the application, I would like to give you some background about some major issue facing dentistry. And this project is a very close collaboration with a dental surgeon, Professor Anne Simas. She is from Queensland University. And what they do, they usually use lipoxin A4. Lipoxin A4 this is the small molecule. And this has been used for treating gum disease and treating, it seems like this one, improving the osseointegration between the bone and the teeth, especially if somebody has lost some of the bone surrounding the teeth, then they use this material, lipoxin, which is well-known biological compound. And it has to be, this is, by the way, it comes in water, and it is very, very low viscosity. It has to be injected almost like once a week in order to see some improvement in the repair of the bone surrounding the teeth, particularly with people who is smokers, people have issues, diabetics, etc., etc. So when we talked to her and we wanted to find out what exactly she wanted to do, the way she wanted to find out if there is a way to encapsulate this type of a drug into some type of a biodegradable polymers. And there is some requirement, which I'll show you what is the design criteria for that. And this, of course, the design criteria didn't come overnight, but we had so many discussions, so many proposals, different ideas in order to come up with this idea, which I'm going to show you shortly. So if you look at people who has mainly gum disease, you could see this side of the bone, you could see the bone recess, and it start exposing the nerves and start if you leave it untreated, then the bone become looser and you lose your teeth. Sorry, the tooth has become looser and you lose your teeth after a while. So it has to be treated. So it's called periodontal disease. And also they have issue with people with the failure of dental implant. Dental implant, it's a titanium screw. It's been screwed into the bone, but in many cases, the osseointegration between the bone and the screw, it is not happening, as expected. And the reason for that, of course, if somebody has a weak bone, some people who has diabetic, some smokers, people drink alcohol. So there is issues with the failing dental implant. Again, they would like to find out if people having dental implant, how can be treated with this drug again. So I think we're having two issues here. We have the periodontitis called, and this is called peri-implantitis. So they are the two names, dental names, which it is difficult for me, but I mean, this is what I understood from our colleague from the dentistry school. So they really need to try to treat this with that drug. Again, as I always like to highlight, is collaboration between us as a material scientist with the dental surgeon. It is very, very essential in order to come with a fantastic design criteria which can really solve their problem and something novel and can be used in the future. So this is here, I'm just listing the design criteria. We agreed to have a material which is injectable. It can be injected between whether it is the tooth and the gum or the implant, leave it for a while and then start to degrade. You could see this greenish material start to degrade and releasing the drug which is encapsulated into it. And so definitely they would like to have a material that can be injected. It is not very viscous and it is not very soft like water. They need something which has a texture. When it's been injected, it can stay in a place until you cure it. Of course, you want to cure it. The curing usually, if it is as I mentioned earlier, if the monomer, it is very thin, like methyl methacrylate and others, they tend to produce a high temperature, exotherm temperature. And this exotherm temperature, it might kill the tissues around the implant or the tooth itself. It's called necrosis. So this is one of the issues. So would like to have a lower temperature, is probably about 55 degree maximum if it is a curing. So using macromolecule like the one I'm going to show you in a minute is definitely going to reduce the exotherm temperature dramatically, which we did evaluate the exotherm temperature. We looked at it systematically and we tried to reduce it, or we reduced it to around less than 50 degrees centigrade. Also, the material has to be biodegradable. Biodegradation, it is important. And also the degradation, it's happening while the drug release. So you degrade a little bit and then the drug release slowly into the area. And of course, there is an improvement on osteointegration between the bone and the other things. The other very, very important criteria, it is the hydrophobicity ratio. You don't want your material to be the hydrogel, because it's a hydrogel. You don't want your hydrogel to be extremely hydrophilic, because this one, it means like it's going to absorb a lot of water and it's going to swell. And if it's a swelling, then it will not be comfortable into any patient's mouth. So really need to control the swellability and the water absorption of this hydrogel. So you need to have a balance of the hydrophilic characteristics of this material. Also, it has to be biocompatible. I mean, you don't want to have, when it's degrading, the material or the polymer, even the other component, you don't want it to be causing any immunogenic response or any cytotoxicity. So it is very important that the material itself and the byproduct after degradation, they should not be toxic at all. So this is really the design criteria. So we have to work within that framework in order to come up with a material useful for that particular application. So we looked into the literature. We found some guy, he is from US, from Oklahoma, I believe. This guy is Kilbertson. He published many publications in very early in the century, it's 2002. And he used this molecule. It has a 16 arm. You could functionalize it. It's hydrophobic. It is polyester based. It's a provide very good site for us. He used it to improve the cross-linking density of dental material, the normal dental material. So we thought, okay, this might be useful because, as I said, it's been used previously in restorative material to increase the cross-link density. It has 16 arms. It is very easy, relatively easy to functionalize and to make use of these arms in order to attach it to different type of polymers. Also, it has low toxicity and low leachability because it's a bulky molecule. It is a nanoparticle, it's hyperbranch nanoparticle. It is hydrophobic in nature, which means if we have a drug like the one I showed you, it can be encapsulated easily into that. So it is a hydrophobic type of core. You could encapsulate your drug. And also it is, you will be able to use it to modulate the porosity as well as the hydrophobicity or hydrophilicity of your hydrogel. If you incorporate this, you reduce probably the swelling as well as you improve the degradation rate. So, and the porosity, because when it becomes porous, water start penetrating through and start to degrade faster. So this is what we looked into it. We looked into that molecule, and this is the molecule. I have some animation here for you. We functionalize it with acetylene group initially, and then we took a polyethylene glycol, again 400 molecular weight, 9 repeated unit of ethylene oxide. And what we did with that, we converted to azide. And of course, we have the acetylene group here, and the azide, we did some click chemistry, the normal nice click chemistry, as you see here, a click chemistry. Then after clicking this, we functionalize it with acrylyl chloride, and we convert it to a polymerizable acrylate group. So we'll end up, I mean, here you could see the acrylate group, and this is a click, and then with this, and then we polymerize it, okay? So we created that molecule or that nanoparticle. As I mentioned earlier, the original nanoparticle, it is not water soluble, it's hydrophobic. By introducing polyethylene glycol, we made it more soluble in water. And also it depends on how long is this polymer chain. We use the longer chain, we use a shorter ethylene glycol chain, but we found this one, it is probably ideal to convert this hydrophobic nanoparticles from insoluble in water to soluble in water. And then, of course, we functionalize it with vinyl group to make it polymerizable. So we're having a polyester arm, provide the hydrolyzable component, because when hydrolyzed, degrade. We have the vinyl group to make it polymerizable, and we have the modulation of polyethylene glycol to convert it from insoluble to a soluble nanoparticles. So we use this one. This is the synthesis of it anyway. We used it in conjunction as a copolymer with diacrylate, polyethylene glycol diacrylate to make a hydrogel. As well as we used it with a tri-block copolymer. We synthesized the tri-block copolymer with PLA, polylactic acid, with polyethylene glycol. And of course, we prepared a variety of these with a shorter chain, a longer chain, very long chain, in order to evaluate how this is performing as a hydrogel with this nanoparticle we made. So we cross-linked it with all together. And now I'll show you the porosity. This is a pure polyethylene glycol diacrylate. You could see there is no porosity. We start adding our compounds to it, the nanoparticle we made. You could see 50-50. You could see there is some porous structure start to appear. You increased it to 75 of that with 25 polyethylene glycol diacrylate. You see the porosity improving. And then when you go for 88% to 12%, you see become very, very porous. If you use this 100%, is extremely porous.
So you don't want it to be extremely porous because it means like it's going to degrade very, very fast. So we don't want to use it 100%. We have to use it in combination with something else. If we use it with polyethylene glycol diacrylate, then this is going to slow down the degradation rate. So that's why we introduced the tri-block copolymer with the lactide, with the polyethylene glycol in the middle, in order to modulate the swelling as well as to modulate the degradation rate. So this is what we did. So we synthesized a variety of composition, 50-50, with the tri-block copolymer. This is the one. We used a zero lactide, as you see, zero polylactic acid on both sides. Is only pure polyethylene glycol, 22 repeated unit. We used it with 2.5 units from both ends. We used it with 5 units both ends. We used it 10 units both ends in order to see which one is more better for us with regard to equilibrium swelling rates. You see, this is a zero, this one. It doesn't have any polylactic acid. Swelling, it is relatively good, okay? But when you start increasing the lactic acid, because of the phase separation, because of the porosity, start to take more water. And if you go to 5 repeated unit, you find the swelling rate start to reduce. And the reason why it is reducing, because you're introducing a hydrophobic component, which is the polylactic acid. And if you go to 10 repeated unit, you see almost they are quite similar. So there is no change. So we thought probably this is the right composition. We should really focus on our study. The 5 repeated unit, both ends, which is tri-block PLA PEG. Use it with this Bolton 20 functionalized with acrylate. Again, what we are interested in looking into the degradation rates, because our dental friend, she said she wants something to degrade within relatively good time, you know, like 100 days, plus minus 120 days, etc. So really, we have to engineer our material to make it degrading within that time frame, as well as to make sure it does not swell too much. So there is too many requirements, and we have to juggle all these variables in order to come up with a composition which satisfy most of these requirements. So if you look at, for example, the one with the 5, it is this one, okay? It's degrading, almost losing 60% of its weight within probably around 100 days, which is pretty acceptable. While you find these two, they are relatively faster, losing almost like 80% of their original weight. And this is actually, if you see the last one, we made another composition with much longer polyethylene glycol with 5. And you see this one, you see the impact of polyethylene glycol because make it more hydrophilic. It takes a lot of water. If it takes a lot of water, it increases the hydrolysis of PLA. So this is why. But we found this one, it is probably the ideal according to the requirement by our friend dentist. Now we look into how the morphology change. If you go 0 week, 8 weeks, you could see there is pitting inside. This is SCM. And then if you go for a longer 16 weeks, you could see the polymer start to fall apart. And the fantastic thing, what we saw, which is, I think this was published in that journal, Soft Matter, on the first page, you could see how the pitting start to happen initially. This is after a couple of days, you know, 3-4 days, I think. And you could see the pitting in the surface and showing how the degradation started and start to fall apart. So this is really where we are with this material. Okay, now, after we made it, we have to evaluate it. Of course, we looked into the cytotoxicity of that, and this is a simple test where they do it. We did more than that, by the way, but I mean, I wanted, just because of today, I wanted to show you briefly what is the main results. And this is a confocal image this is a in vitro cell viability and cytotoxicity test. You could see the green one, they are alive. The red one, they are the dead cells. So actually the majority is green, which means that the material is not toxic. At the same time, what we did actually, the PhD student working with Professor Ann Samus, he used rats and he created a defect in their mandible. He drilled a hole. As you see, this hole is about 2 millimeter by 1.5 millimeter in diameter. You could see it here surgically. And then we filled it with our material, injected in with the drug. And we left it for almost 20 days. And then they sacrificed the rat, killed the rat, and they found out after taking the bone and analyze it, you could see the filling start happening, remineralization of the bone. And you could see it here. It's still not complete, but it is start filling after 20 days. So it is really like a successful in vivo experiment of that, which is to treat the bone defect with lipoxin A4 encapsulated in our composition. Briefly, I'll go for another, which is another exciting area, which we did a lot of work on that. This is a project which is funded by the Queensland government. By the way, these two projects, the dental and this one, both of them, they were funded by the Queensland government. We received almost like, for combination with other projects, almost like one of them is a $3.9 million and the other one is almost about $2.9 million. For this particular one is $2.9 million. Spinal cord injury, it is one of the major issue in, especially in the Middle East. It's from car accidents. Car accidents causing injury of the spinal cord is mean paralysis for life. So this is one of the major issue we are facing currently, especially in the Middle East, in Kuwait and in Saudi Arabia, etc. And the reason for that, you injure the spinal cord, the injury by bruising the myelin layer. Myelin layer, it is on this, they call it the exome. And the myelin layer, which is covering these nerves. And if it is bruised, then this is causing an issue. And this is triggering a myelin-associated glycoprotein, which inhibit the regeneration and regrowth of this neuron cell. And of course, demyelinization causing significant loss of motion, locomotive and movement, etc. So people with injured spinal cord always, they get either quadriplegic, which is رجلين والإيدين ما يتحركون, أو diplegic, which is only the lower part. And there is no control even on their bladder. So it is, usually they treat such things. Initially, it has to be treated quickly by transplanting neuron stem cells with growth factors to improve the remineralization of the axon and subsequently, of course, improve the motion of the person. And of course, it is unpredictable, this type of a treatment, and is very, very hard to control, because when you inject neuron stem cells or stem cells, usually could cause other complication in other tissues of the body, because it's going to be probably circulated through the blood. So what we are agreeing with our collaborator, she is actually a neurosurgeon, Professor Tsai, Dr. Tsai, she is from Canada. And of course, she was active in working in this area. And she came and we had a very, very intense discussion in order to come up with something which might help her in doing this task, which is trying to treat the spinal cord. In general, a successful spinal cord regeneration strategy is likely to require combination, cellular, biomolecules, as well as biomaterials approach. So there are three of them. Stem cells, this is called brain-derived neuron protein, type of protein. And then, of course, here you could see we made some nanofibrous material from certain polymers, which is the triblock copolymers and others, in order to use it to wrap, to seed the mimic of the BDNF, as well as the stem cells. Probably in the next few slides, I will show you what it is. Again, I don't want to go through the chemistry again in detail, but I always like to highlight the design criteria of this type of material. The requirement, it has to be biodegradable within a desired time frame, 8 to 12 months. It has to be biocompatible, non-toxic, non-immunoresponse. The mechanical property is very, very critical in here. What she explained to us, I haven't seen it, but what she explained to us, she said the spinal cord, usually the texture of it is pretty soft. It's like, she mentioned that it is like a Philadelphia cheese. So it is a tiny, very, very softy material, like cheese. So it's easy to injure it. It's easy to cause a problem to it. So we really need to design our material to make sure that it will not cause more damage, and it has to be soft, and especially if it is in contact with the spinal cord. The material, it has to be processable. How we process it? Can we make a network of that, a mesh network? So it has to use probably electrospinning technology. Probably I have a slide on the electrospinning I could show you later on. And also to support the neuron cells, the growth and proliferation. So what we decide what to do with this project, we looked into a variety of polymers, and we used, here is polycaprolactam, block copolymer with polyethylene glycols. And also, without going into details, we used polyurethane based. Okay, we use a polyurethane linkage into it, and you could see here the polyurethane linkage, and we have to insert the spacer. And this spacer useful for functionalization in order to tether this mimic compound, which is a bioactive small molecule, it's called brain-derived neurophilic protein, which is a mimic type of things. So this is where it has to be linked into it. We collaborate with somebody from Monash University. He used to be one of my honor students. He worked with me for a couple of years, and he has his group. He was interested in doing this type of work, and he used this compound to inject into the brain in order to use it for, I think he was telling me it's used for treating Parkinson and dementia or whatever. So this type of, to encourage the function of the brain type of things. So we did prepare this compound with this polymer, which is pretty complicated. But if anybody interested, I could show you all the steps in doing that. I don't want to go into that since we took quite a long time. And then, of course, we electrospin it to making a mesh like that. We seeded this is the electrospinning. You dissolve your polymer. It's like an injection, and you could spin it either in a roll or on a fiber. Here we spun it in a roll on a tube, and we make something like that. And this is where we use it to protect the spinal cord. It can be cut and protect the spinal cord. And then we seeded, of course, the stem cells onto that. And of course, we did a lot of biological. I didn't do it, but my postdoc, which is Fiona Filardo, she did all this work, which is fantastic work. She tried to make sure that this, what you call it, the stem cells has been derived and converted to a neuron type of cells. So she did all this staining, different type of staining for the DNA, some specific marker for the antibody, some other markers for the neural function, so the green, the red, and the blue, to make sure what we are putting, it is converted to neuron cells. And this is actually showing a fantastic picture where you could see the neuron cells coming from this embryonic body start growing in all directions. So this is one of the successful projects in this area. We gave this material to our friend from Ontario Hospital Research Center, Professor Tsai, and she took a rat, and she chopped or cut the spinal cord, as you see here, and then she wrapped it with this material, and she started monitoring the reinstallation of the movement of the back legs, the tail, and also control of the bladder. And she was using, in this case, an MRI images in order to see how the bruise is happening and how the repair is happening in that. So there is a progress in this area using polyester urethane with polylactic, lactite and carbolactane. Sorry, I'm just getting too many mix up. Okay, so the last thing, which I don't know whether I should really go for it, I might go quickly, very, very quickly. It is to engineer artificial blood vessel. As you know, everybody, people having a heart problem, they usually take a vein from the leg and they graft it into the heart as a bypass. So this project, it was in collaboration with a vascular scientist from the hospital. And we did work by inserting a plastic tube like that, polyethylene tube, into the peritoneal cavity. The peritoneal cavity is between the skin and the guts, you know, المعدة والأمعاء وإلى آخره. غشاء خليها بيناتهم. And if you leave it for 2 weeks or over or 3 weeks, it find, because of the foreign body response, it forming some sort of a thick layer, you know, fibrous tissue. And this fibrous tissue, it is almost like a artery or a vein. And you recover it from the same person and you pull out that plastic tube, you'll end up with this tube. And this can be really used as a for the bypass instead of taking a vein from the leg and put it in the heart. However, there is issue with this. It doesn't have elasticity. It will not take the pumping of the heart, so it burst. I mean, they already grafted it in rats. They found it survived for 4 months. In a rabbit, 16 months. In a dog, is 6 months. But they claim it have lacking of elastin. And the problem, we really need a material to temporarily compensate for the elastin. And then this material will degrade slowly. And after degradation, because the body start to produce its elastin automatically, slowly. So you need something which is temporary. It has some elasticity. So what we did, the aim of the project, it is to develop a scaffold for growth of artificial blood vessel, you know, using systematic degradation or synthetic degradation polymer with elastic property. So this is really where we have to find some material with elastic property. So to start thinking of the material, we have to go to the abattoir, اللي هو المقصب. And we collected a lot of veins from big animal, from حشاكم pigs, from بقر إلى آخره. And we did this stress strain curve in order to find out what is the mechanical property of these veins. And you could see a quite variation. Some of them very strong, some of them very weak. So we draw a line in the middle here. We thought we design our material to be in that stress strain curves, this type of mechanical properties. So we decided to go into ring opening polymerization of polytriethylene carbonate. You know, this is with the lactite. And then we did the polymerization of that. We, of course, made a variety of dye blocks, different compositions in order to come up with material which has the reasonable mechanical properties. So we did analyze all the mechanical property of this, and we did all the work for that. And now we had to implant it. We wrap it. We wrap the plastic tube and we put it in the peritoneal cavity, and we recover it after 3 weeks. And we looked into some of the elastins and some of the expression in the biology. And of course, we found it is, especially with elastin, there is some elastin start forming into that. So I think, again, this is still way far away from using it in actual human being, but there is some positive signs that we will be able to get something hopefully in the future. Let me wrap up now. seems we already went overboard. I mean, very, very long. Is building for the future. I showed you, I hope I'm successful in showing you, we developed a platform technology. It is a state-of-the-art approach to design and engineer a new class of material. This is, hopefully I showed you that. And then the application of that, it could span all over. If you are environmental chemist or if you are environmental engineer, you might use this type of technology or you collaborate with somebody who can really use this technology for detection of air pollution, heavy metal separation. In the petroleum area, you could go even for the catalyst, especially if you go for the new material, اللي هو MOF and COFs. MOF, which is metal organic framework, and the other one, which is ZIF, is zeolitic frameworks. They are definitely used for catalyst. Gas and hydrocarbon separation. You could separate even propane from a propene. In certain cases, you could design some membranes with this characteristics. Detection of toxic gases. In the water area, it is very, very heavy. The purification, like RO, reverse osmosis, forward osmosis, anti-fouling, and other application. In the biomedical, which I probably covered more than enough for you, in tissue scaffold, in a drug delivery, in dental application. Also, there is a fantastic area now, everybody look into it, carbon capture. I mean, this is, I did not talk about it, but we are currently having my team in Kuwait now. We are working in collaboration with Berkeley in looking into carbon dioxide capture using different type of architecture and different type of material. Storage of hydrogen, as you know, hydrogen is going to be the new fuel for the future, the clean fuel. So I think storage and transport of hydrogen, it is a critical thing. And there is a big room of that. We could really work into that. And before I'll end up, again, advanced nano structured material represent very exciting and cross-cutting research discipline. I think it would be really good for us to be always needed and collaborating. Collaboration, please. Don't work by yourself as a chemist in vacuum. You don't collaborate with others in order to share your talents with that person, your novelty, in order to design material to suit them. This is probably the most important last point. The approach adapted for targeted material design is very useful in handling a complex project. You see how complex is the project, with very, very clear pathway to impact. There is a clear pathway. There is a direct application. You could use it. You make something, you could see the end of it is going to be used. And thank you very much. And this is my email here, if you would like to contact me, both at UQ and also in here in Kisser. And of course, I would like to thank Professor Mohammed Rubai. And of course, I'm part of NISA, and I'm proud to be part of this fantastic team of NISA. And this is all the people in NISA. As you see, even though I'm here, I am Shabab. I was, my picture at the bottom. ما أدري ليش دكتور محمد مخليني تحت ما مخليني فوق ويا البقية. And thank you very much.
شكرا جزيلا دكتور، عاشت ايدك محاضرة.
الله يخليك، الله
يعني
يخليك.
اروع من الروعة، يعني ما بيها مجال.
It was too long, yeah, Athir. It was too long, yeah. Anyway, shall I stop sharing? I stop sharing.
شوف إذا أكو أسئلة وواحد يحتاج الآن. دكتور أحمد عياش، تفضل.
دكتور أثير تسمعني؟
دكتورة علا.
اوكي، بس احب يعني اشكر دكتور فراس على المحاضرة الرائعة. يعني it's fantastic I think. The most interesting part is to show like a real life application instead of saying just like potential application or these materials can be used for. I think this is the most interesting part. I have actually two questions. The problem I have to go to pick Mahmoud from the
العفو علا، ممكن stop sharing حتى I could see you when I like to talk to people while I'm seeing them. If we need to reshare again, I will reshare again. I'm going to stop sharing.
I think I need your slide actually. If you go back to the acrylated bulletin that you showed, I just would like to ask how was difficult or easy to manage the functionalization of 16 arm chain, to be honest.
Which one, the Bolton?
The Bolton, yeah, the acrylated one.
Don't tell me. It was a nightmare.
Yeah, I know. For this reason,
Okay.
I'm asking about this.
It was nightmare, but I think probably Athir knows very well. He knows David Wang. Now he is with Sydney University. David Wang, he was my PhD student.
Yeah,
Poor
I know.
things, he struggled. I
Yeah,
mean, to
yeah,
get it pure, it is a nightmare because it is very, very hard to get. Either you get no functionalization or you get difunctionalization.
exactly, yeah.
And because of the polarity of the molecule, it is very, very hard to separate in the column.
Exactly, yeah. Yeah, it's just stuck to
I
the
think
column.
in the publication we might mention something about that, but I guess again, publication we don't say much.
Yeah.
So it is hard.
Yeah, yeah.
Okay.
Okay, that's fine. So this
Okay.
was this is the first question. The second one,
Yeah.
if you go back to your early slides when you show, you know, the brush, when you talked about the brush and the functionalization of the ATRP initiator.
Yeah. Which
Yeah.
one? This one?
No, the more earlier slides.
Okay.
When you talk about the problem, there is no slide numbers. When you talked about this self-assembling polymer system,
Okay. You mean using this?
Yeah.
This one and
yes,
that
yes,
one?
yes, yeah, exactly, yeah.
This one.
Was it like the functionalization of the ATRP on the surface? Was it like a uniform? Did you manage to get a uniform distribution? And does the uniformity?
Well, this molecule, sorry, Dr. Aula, this is actually a small molecule, so it's easy to monitor it, okay, to attach this.
For the one that you mentioned.
But for the other ones, for this one.
Yeah, this one.
From the plastic you're talking about.
Yes.
Yeah, okay. Look, it is again, you could get it, you get some uniformity. You mean, I don't know which one you're talking about. Let's see.
Yeah, the plastic one, yeah.
Let's take an example of this one, for example. You mean this one?
Yes.
This one, okay. This one is, again, as I mentioned earlier, it is pretty important to have a uniform injection molding process where you have your surface, it doesn't have any stresses. So to control it from the base, if you control the injection molding, and you make sure there is no stresses in the injection molding, and when you graft a layer of, for example, we grafted styrene, you know, you use all these surfaces, we soak it in a styrene solution in dichloromethane, and we zap it using gamma radiation, and then of course we wash it, etc., and then we functionalize it. We functionalize it using different techniques. You know, either you put aminomethyl or you put something, whatever. So whatever functional group you put there, this is the one it's going to be. So it is, again, it's a start from base. As long as you perfecting the surface initially, you will have no problem.
Yeah.
But if your surface, if you buy a piece of plastic from the market, it will not be the same. So that's why, I mean, this is where we put a lot of knowledge, and this is, we could not patent, by the way. This area, it could not be patented because it is a know-how. It is very simple. Everybody doing grafting, but nobody knows how to control the morphology of the plastic by injection molding.
Yeah.
So this is where we have the art. You know, this is the magic hands to do this.
Okay. Thank you so much, Dr. Firas. Thank you.
اهلا هلا فيك. الله يخليك.
دكتور محمد تفضل. دكتور محمد الرباعي.
واحد قبلي
يهون علينا دكتور احمد ان شاء الله بعدك.
اوكي.
هو ما لحق يسأل دكتور محمد، ما لحق.
What should I say?
الله يخليك.
Professor Faras, thank you so much for this fascinating lecture. I honestly enjoyed it. I found it incredibly informative and inspiring.
Thank you.
I
Thank
think your insights into the field were truly eye-opening. Really, it's wonderful to hear you. Your ability to explain complex concepts in a clear and engaging manner made the materials you're talking about truly accessible and enjoyable to learn. I honestly thank you from the bottom of my heart for this lecture, which I enjoyed. I haven't heard such a lecture for a long, long time. And,
Oh, thank you. Thank you. Thank you,
I'm
Dr.
retired
Mohammed.
for
Thank
long, and
you.
I enjoyed really to listen to
Yeah.
a true science.
Mhm, mhm.
But I shouldn't leave without asking questions.
Go ahead. Yeah.
Let me take you back to the start of the lecture.
Mhm, mhm.
Perhaps you still remember something about it. I'm curious about the potential of using a plasma instead of gamma radiation. I
Yeah.
have used in the past
Yeah.
called the plasma
Yeah.
for modification of the surfaces, which is it's really good
Good
technique
technique.
to modify the surface, especially for cell attachment or for grafting. But
Mhm,
if you are aiming for specific functional groups on the
mhm.
grafted materials, plasma might offer more control in this aspect.
Yeah.
Could you
Yeah.
offer some insights into the comparative
Mhm,
advantages,
mhm.
limitations
Yeah.
uh,
Yeah.
of each
Yeah.
approach? I mean gamma
Of course.
radiation versus
Yeah.
plasma in
Yeah.
relation to application of services for diagnostics.
Yeah. Doctor, the things we use the plasma. I use the plasma especially to look into, this is a long time ago when I first went to Australia in 1991, 92. We were using plasma as a discharge to look into surface modification of polymer, which can be used for space shuttle. The project, it was in collaboration with NASA. And they have a lot of different type of polymers, and they would like to study the impact of atomic particles on the surface of polymers, how they degrade them, etc., etc. So this is where I've been introduced to plasma, and at that time we built up our own plasma. It is very, very simple: vacuum glass tube, and in that tube we put a radio frequency discharger, and then of course you introduce gases, different gases, whether argon, whether it is oxygen, whatever type of gas, and then you put your polymer and you bombard it with the particles, whether it's atomic oxygen or radiation, which is a vacuum, very, very short wavelength radiation, etc., etc. And we characterize this, and we published many of that previously. However, in the polymer area, what we are trying to do now, we are trying to put a thicker layer, and using a plasma because what we are trying, again, we try to functionalize that layer and try to do a lot of chemistry on the surface, not only putting a biological compound or biological biological molecule. We are trying really to put some build-up chemistry, nano structures, etc. And we found the plasma, it is very, very hard for us to apply, because if you want to introduce monomer into the plasma and then you polymerize it, deposit it on the surface, it will not deposit uniformly. Plus, it depends on how the monomer is. If the monomer, you could make it like in a gaseous gas form under vacuum, then you might be able to deposit it uniformly. But some of the monomers, they are pretty viscous. It is very hard to use it in that manner. But I think it is well established technology, and I think unfortunately we haven't used it for that particular application, but we used it before for others. I hope I answer you, Dr. Mohammed. Dr. Mohammed, I hope I answered you.
تمام. خلينا ننتقل دكتور أحمد عايش، تفضل. صوتك دكتور محمد ماكو صوت مالته.
He's mute.
دكتور بس ارفع ايدك دكتور محمد. خلي اشوف بس الاسم حضرتك.
He's mute دكتور
أي.
محمد.
مساء الخير جميعا.
اهلا دكتور احمد.
مرحبا دكتور فراس. طبعا
أهلا
اول
وسهلا.
شيء يعني اشكرك على المحاضره الرائعه. انا دكتور احمد عياش من الجامعه المستنصريه
أهلا وسهلا.
بغداد. حقيقه ريتش المحاضره and we are proud of you. يعني scientist فرصه التقينا بيك. I've got only 2 questions.
تفضل.
Okay. A question about the kit, the diagnostic kit. Structure, you've got a porous structure. وهذا يعني من شرحت الفينومينا مالته يعتمد على condensation of water droplet on it, and when the water evaporate that make the honeycomb structure. Please correct me if that
Yeah.
it is not
Okay.
correct.
Well, it's a
How
small
you can
correction.
control the process?
Okay.
Okay.
Okay. It is pretty. I mean, there is a couple of French publications. Unfortunately, I did not quote the reference in my lectures, but I try to dig it out. If I find it, I will send it to Dr. Athir. Maybe you will. The simplest thing, if you dissolve, if you put take any polymer and you dissolve it in say, for example, in dichloromethane, which is a chlorinated solvent, is very fast evaporating solvent.
A solvent.
Okay, any
Yes.
solvent. It depends on the polymer and the solvent. And if you put it on a glass,
Nature solvent.
Any surface like a glass or a polymer, and then you put it in a fume. This is actually, it's happened not to us, but it's happened to the other guys some time ago. Very, very old publication in the 70s, I think, or 80s. They put it in the fume hood, and it seems like it was a humid day, and and because of the flow of air through the fume hood, it start to evaporating the solvent quicker. And when the solvent is evaporating, it's try to be the surface become, or the polymer become cold and start condensing water. And this water droplet start to form this hexagonal shape. Probably when they first show it, it was not controlled. But then now for us, we could control it. We could control it by putting it in a special container.
This is my questions.
Yeah.
Mhm.
Yeah. So we could control it very, very simply. Very, very simply. You put it in a some sort of a container, like a glass tank, and you make sure you put very, very fine flow of probably air going through, but it has to be wet air. It has a lot of moisture. So at least you will be able to form, أثناء evaporation, you form this water droplet condensates. And they are, if the level of the water or the humidity is appropriate, like 80% or so humidity, you find the water start to forming this hexagonal shape, the droplets of the water. And of course, honeycomb structure. So when the solvent is all gone,
Okay, is it clear? The phenomenon is clear for me. But to get each single experiment the same result and the same distribution and the same size approximately? If I can say that.
It is, again, look, it is you have to try.
It seems, yes.
It's art. It is art.
Okay, I get it.
There is no.
I get it.
It is not like.
I get it.
I cannot give you a procedure 1, 2, 3, 4, 5. It is art, and this is always the know-how.
I see.
If you have a magic hand as a chemist, you will be able to do it. Okay.
I get it. I get it. Thank you so much. The second question is, it is very interesting how you can detect the level of H2S. I mean, I've got another questions about your technique, how you can detect H2S by nanoparticles, and these nanoparticles and when exposed to H2S can become fluorescent. Is that correct?
Yes, correct. Because we had a functional group.
What is the wrong with the H2S probe? Yeah.
Oh, it is. Look, the H2S probe.
It seems to me is a complicated process, because you have to inject nanoparticles the well, and then you have to collect them, and then after that you have to analyze them. Instead of that, you can't put a probe, and this probe give you the level of H2S easily.
Okay.
I mean, in
Okay.
terms of cost,
الصوت
how you
يتقطع.
قطع
Yeah.
دكتور أحمد،
can-
جاي قطع الصوت عندك.
Yeah. Okay, I think I've got the question. I've got the question. Look, I agree with you in certain
Yeah.
extent. The probe, it is good. It has been used before. It is useful.
This
but-
is from my end.
Yeah. ممكن أجاوب. It's okay. I understood the question. ممكن أجاوب دكتور أحمد لو
اوكي دكتور.
Okay.
هو اعتقد بسبب النت عنده مو تمام، يجي متاخر الصوت عنده.
That's fine. شوف, the probe, it is good. It's been used for long time, especially in the oil exploration. Because if you have a sour well, then it is a lot of companies, they will not produce oil from that. So they use the probe. The probe, it is well-established technique. But what we did, actually, this is some sort of a novel application of this material. This is one example. I mean, because our client, he wanted to use this material, and we gave him a variety of different material. And of course, it's still early stages, but we proved that the technology is pretty flexible. Technology, it is pretty easy, especially in the oil production. You have an injection well, you inject water in order to enhance the recovery of the oil. You will be able to inject this with the other mixture. And you typically you collect whatever you collect, and then you will be able to take a sample and you analyze, and you could see what is the percentage of the fluorescent material. So this is a technology, but it is not limited to that particular application, not necessarily H2S. Again, this is open the door to think of other sensors for other gases, for other area. I mean, the probes, probably you cannot use it in the oil industry, but you cannot use it in a room. You cannot use it somewhere else. So you could think of whatever functional group you will be able to do. You can do it. You can change the functional group. You can change the technique of analysis. In our case, we use the fluorescence spectroscopy. You could use something else. You could use infrared. You could use whatever. So I think it's what I'm trying here to give that example to show you the novelty and the breadth of that technology. This technology can be applied anywhere. So according to your imagination.
تسلم دكتور. ايفون، اسم ايفون بس، ده ممكن سؤال؟ ايفون رافع ايده، ما اعرف منو. اذا ماكو دكتور حازم، تفضل دكتور حازم.
السلام عليكم.
عليكم
السلام. هذا الدكتور.
شكرا دكتور فراس، حقيقة محاضرة أكثر من رائعة. شكرا للمعلومات الجيدة. حقيقة أنا متخصص بالشأن البيئي، فإذا تسمح لي قد يكون السؤال related. وحضرتك في معهد البترول، جنابكم الكريم تعرف حاليا أنه العالم كله مهتم بالوقود الأحفوري ومسألة المناخ والتوصيات العالمية، اتفاقية باريس وكوب، إلى أن وصلت كوب 28
مال دبي.
توصيات التحول الطاقي ل 2030. وحاليا أعتقد في كاليفورنيا حددوا 2027 هو نهاية استخدام وقود البنزين بالسيارات، ومن المؤمل إلى عام 50 توصل إلى حالات متقدمة من اتخاذ الإجراء تجاه تغيرات المناخ. أنا سؤالي في هذا المجال، العلم، أين العلم؟ أين التكنولوجيا من جانب استغلال الثروات الهائلة للوقود الأحفوري، فيما لو وصلنا إلى مرحلة عدم الاستخدام التام؟ هل هناك تقنية مستقبلية لمعالجة البترول قبل ما يوصل المصافي؟ أو هل هناك تقنية مستقبلية لهذه المكامن للثروات الهائلة للأجيال القادمة؟ شكرا جزيلا دكتور.
شكرا دكتور حازم. نشوف الكويستشن طبعا هو شوية خارج عن اختصاصي، بس يعني أنا could really answer you what I can in my area. طبعا في معهد الكويت للأبحاث العلمية في البترول سنتر مع البتروليوم تكنولوجي سنتر there is a lot of work in developing clean fuel. انت عارف الفيول بالمناطق الجنوبية من العراق والكويت وهالمكانات بها high level of sulfur, and this is a pollutant, as you know. And there is a lot of technology now using different cracking and different catalysts, etc., etc. And there is a lot of activities بين شركة نفط الكويت والشركات الثانية اللي هي الريفاينريز قاعد يشتغلون على clean fuel, and they are producing a clean fuel اللي هو very low sulfur content. This is من one side. الشغلة الثانية اللي هي مهمة بالنسبة now تعرف أنت after COP 27 الكويت مثلا ما أدري بالنسبة للعراق شنو البوزيشن مالها، بس الكويت هم they decided ب 2050 they try to have carbon neutral. this which does not mean you stop production of oil, but as long as you capture all the greenhouse gases, particularly CO2, which is equivalent to what you're producing. لذلك من يبيعون النفط مالهم يكون هذا النفط يقول لك is already been stripped from the green gas, the pollutant, which is the green house gases. Okay, so this is what they do. في احنا عندنا مشروع كبير مع بيركلي to work on developing a new material. It is called COF, which is organic framework, covalent organic framework, as well as MOF, which is metal organic framework. This chemistry, if you go and search for Professor Omar Yagi, هو أصل عربي في بيركلي، أستاذ في بيركلي. He is a master of this technology, of the chemistry of this technology. We are collaborating with him in order to take his technology, the COFs and the MOFs and the ZIFs, هذول كل الأسامي مالتها, and we prepare a composite with different functional group in polymer. We make a membranes, different type of membranes with different type of polymers, which unfortunately I cannot talk about it at this stage because it's all still in the research stage, and to maximize the efficiency of capturing CO2 from the atmosphere. طبعا CO2 you know it can the major pollutant بالعالم كله هم الpower generation والwater desalination. هذول they are producing about 56%، خاصة بالنسبة لدول الخليج، لأن تعرف أنت الwater كله produced from the sea, and they use a lot of energy, they burn a lot of oil in order to produce pure water, you know, like drinkable water plus power, كهرباء. They are about 56% of greenhouses coming from these two industries. There is a 25% is coming from refineries, and there is additional about 25% is coming from transportation and the other smaller industries. Transportation, especially cars, big cars, trucks, ships, etc., etc. هذول كلهم they produce almost 25%. عادة صناعات النفطية they look after their CO2 by capturing it from source. كل شيء يطلع من المداخن يدخل في source mainly containing diethylamine type of solution. It will capture the CO2 and release the other gases, and they take the water which contain a lot of this diethylamine reactions, carbamates. The carbamates, they heat it up and regenerate it, and they take the CO2. The CO2 can be used for a variety of applications. One of the applications, they use it for enhanced oil recovery. They inject it into the ground in order to enhance the production of oil. So this is one cycle of that. The other cycle, احنا في المشروع مالنا احنا we are focusing only on the atmosphere. اللي هو بالاتموسفير there is a lot of transportation, cars الى اخره. فانت لو تخلي الماشينز مالتك قريبه من الفري ways, you will be able to capture a lot of the CO2.
what is the plan? What we're going to use this CO2 for? This CO2, there is so many venues to use it. Then until you capture it, what you're going to do with it? We could use it for growing algae. Algae, it can be used. This is one venue, and I'm just telling you about it. Probably you might need to think about that. And I'm quite happy to give you a summary of all this in a separate lecture. You could use algae. That algae, it could really, because you fast growing the algae, you could use it for making a lot of food additives, dyes and other food additives. Also, you could use it for producing biofuel, biodiesel. Okay, so this is where you change from اللي هو البنزين أو النفط العادي إلى biofuel or biodiesel. You could use it for converting it to certain chemicals, the CO2, like formate and acetate. And formate and acetate, you could use it to feed bacteria to produce biodegradable polymers. So there is a lot of a nice chain biological compatibility and things like that. You will be able to use it. And you could convert it to natural gas, to synthetic gas. You could do a lot of things. Plus, of course, the smaller scale, which is soft drink, وإلى آخره, something like that. But there is, if you go to the literature, you find a variety of way how to use CO2 and convert it to something else. So I think if we reach that level, whatever we produce, oil, we capture all the CO2 produced from it and use it for something useful product, then this is a fantastic thing to do. I think probably I answered your question in particular, but not exactly. But I gave you probably an overview of how people think عالميا.
Thank you very much, دكتور فراس. Thank you.
عم دكتور حازم أحد أساتذة الكبار البيئة في بابل في الحلة.
ونعم، أهلا وسهلا يا دكتور حازم، الله يخليك.
جامعة القاسم الخضراء.
نتشرف بالأستاذ الدكتور فراس، وتحية لحضرتك دكتور أثير المحترم.
الله يخليك دكتور، تسلم عيني. الأسئلة يعني كثير كتبوا لي، وحتى على الخاص وصلت لي إنه يريدون المحاضرة PDF. هنا ماكو محاضرات PDF، ما ينطون، ممنوع. فراح يكون التسجيل إن شاء الله بعد ساعة، تشوفون التسجيل موجود باليوتيوب، بالقناة مال اليوتيوب، وتستمتعون بالمحاضرة إن شاء الله.
شغل سنين مو سهل ننطي هالشكل.
بالضبط.
شكرا يا دكتور.
أنا أدري بيك كلش تأخر الوقت عليك هسه.
نو اتس اوكي. بكره
حتى بعد ما راح أقابلك هسه من نخلص على باكر.
نو اتس فاين عطله بكره عطله، ما في مشكله.
تمام، مباركين طبعا الإسراء والمعراج. الله يحفظكم إن شاء الله.
الله يخليكم. وشكرا جزيلا على تو هوست مي، وشكرا يا دكتورة علا وأثير والجماعة كلهم. يعني
بس دكتور محمد إذا عنده بعد أي تعقيب أو شيء، لأنه كان انقطع الصوت عليه. دكتور محمد
الرباعي.
انفتحت. شكرا جزيلا.
الله يحفظك.
أنا مجرد بدي أشكر مرة ثانية دكتور فراس على هذه المحاضرة الرائعة، وأتمنى له التوفيق، وأتمنى لكم الدكتور أثير، أشكرك جدا على تقديمك المحاضرة الرائع، ونرجو أن نشوف ونسمع محاضرات مثل هذه بالمستقبل
إن شاء الله. مستمرين احنا دكتور، كل أربعاء محاضرة في شتى العلوم إن شاء الله، فنتشرف بوجودكم. وأنا بعد منه وجاي راح نحسب عليكم تقاعدت ترى.
هلا بيك.
أنا بعدني ما متقاعد يا
أنت بعدك.
دز لي الإيميل مالتك أو التليفون حتى.
وإن شاء الله إن شاء الله دكتور. تسلم لي حبيبي. أمسية يعني سعيدة جدا إن شاء الله، وكل عام وأنتم بخير بذكرى الإسراء والمعراج إن شاء الله.
الله يخليكم.
أعوام مدينة بالخير والبركة بمحمد وآل محمد. نشوفكم إن شاء الله الأربعاء القادم في محاضرة جديدة، وتصبحون على ألف خير. مع السلامة.
الله يخليك. مع السلامة. Thank you very much.
شكرا لك دكتور. الله يحفظك.
Thank you.